acknowledge an individual in the community who, as an administrator of a public or nonprofit human services agency, has excelled in providing leadership for their agency in human services. This year's winner was selected based on evidence of overall planning and superior effort. Here to introduce this year's winner, Heidi Parker, with Executive Director of Immunize Nevada, is her Assistant Director, Community Planning.
Good morning. I am so excited to be here to recognize Heidi for this award. I've had the privilege of working with Heidi at Immunize Nevada when I joined almost 4 years ago, and Heidi is just one of those people who gets things done. We often say that we complement each other really well the way we work, and we'll brainstorm, and you all know those brainstorming sessions where you come up with these brilliant ideas, and Heidi is actually one of those people who takes those cool ideas and gets them off of that sheet that's hanging on the wall, and then they get done. And as I'm about to share with you, the past 2 years really demonstrate just how dedicated and committed she is, and how one person with a vision can really make a change for an organization. Under Heidi's visionary leadership, the past 2 years, Immunize Nevada has evolved from 2 separate immunization outreach organizations under a fiscal sponsor into a dynamic, standalone 501c3. In 2012, fiscal sponsor changes with St. Mary's and the sale of the St. Mary's Foundation prompted a merger between Immunize Nevada and the Northern Nevada Immunization Coalition, which Heidi had served as the executive director for. Not only did she facilitate the merger, as a result, and with her in the lead, Immunize Nevada grew to 4 full-time staff members, funding increased by 122%, and a new fiscal sponsorship relationship was created with Community Health Alliance, which was a great relationship. But in early 2013, that visionary Heidi had other things in store, and she recognized there was an opportunity and actually a need. We'd grown as an organization. We'd been around for 17 years almost. And she knew that it was time for us we'd outgrown our nest. It was time for us to learn how to fly by ourselves. And so she decided, and with the help of others around her, that it was time for us to pursue our 501c3 designation and become a standalone nonprofit. And so she began that tedious process, which I don't know how many of you have ever done that, but it's pretty extensive. It's we had to establish a board of directors. We had to identify a statewide professional council to help guide us. We're a statewide organization, so we wanted to make sure we were representing everyone. We had to find an office, a second office space, and that prompted the second move in just 2 years. And we had to figure out human resources, accounts payable. There's just so many things to starting a new profit. And Heidi did it with grace. She researched it, she knew what she wanted to do, she looked at best practices, and in doing so, I think we're here today standing at an important, stronger organization. Another important thing, during Heidi's time and because of her commitment to immunizations and improving rates, she's been with immunizations for 7 years total, and in that time, I think it's really a testament to what she's done and her leadership. Childhood immunization rates for children 19 to 35 months have improved from dead last in the country to 41st in 2013, and we know we've got a lot of work to do, but we've got the team in place and the organization in place to make it happen. So personally, I have the privilege of working with Heidi every day, and not only is she an amazing leader as an executive director, she's also one of those people who walks her talk in the community. She's out volunteering. Her son is the highlight of her life, and he can also benefit from what, she's just always talking about her family, and she makes that an important priority for us as employees, and I think that I just am very lucky to work with her. I think we're all a better state because we have her working for immunizations, and I'm very, very honored to present this award to her today. Thank you. like to thank the Human Services Network, Eric, Stephanie Cruz, and Katie for this incredible honor. A couple weeks ago, I had a speech prepared about what it means to be fearless and how being fearless helped me affect change at Immunize Nevada. Then something happened. People in Nevada and in Washoe County died from influenza. And the people who had yet to be vaccinated, they started worrying. And for many of the Nevadans we all work with, preventative health care is not on their to-do list, and nor is it easily accessible. For example, to get a flu shot, one has to find a clinic, a pharmacy, a provider's office to see if it's available. They possibly have to make an appointment. They have to wonder if they take Medicaid or other coverage. They have to worry about how much it'll cost and how they will get there if they have to take time off of work. At the same time, they're concerned about fulfilling their basic needs, like feeding their family or staying warm and having reliable transportation. When a no-cost community clinic is made available, they stand in line for hours. They stand in line in 0 degrees, in rain and snow, because it may be their only chance. And they are incredibly grateful for that little shot and the big protection that it offers. And thanks to our grantors and our donors, I'm incredibly grateful that we can provide it. Protecting yourself and your family against a potentially fatal disease shouldn't be complicated, which is why the team at Immunize Nevada, my team, works tirelessly to make vaccine accessible throughout our state. I'm proud of our innovative projects like our mobile flu clinics with Food Bank of Nevada, Northern Nevada distribution sites, and our extensive calendar of school-located vaccination clinics. Through both of these projects, an estimated 6,000 vaccinations have already been administered this flu season. Every flu vaccine given increases our community's immunity, and it protects our most vulnerable clients, neighbors, friends, and family members. But it's not just staying healthy during flu season that people struggle with. It's a non-traditional student headed back to school for health sciences who can't afford the required immunizations. It's a new mom that lost her health insurance and isn't aware of the Vaccines for Children program. And it's a family facing a mountain of medical bills from their child's cancer diagnosis. They need to be vaccinated because their child can't be. The demand for immunization resources is year-round, and each day I'm grateful for my team's expertise, their smiles, diversity, and unwavering passion for our cause. Together, we have built a nonprofit organization that I'm so proud of, and one that allows me to do what I love, which is making a difference. At home, I am incredibly lucky and thankful to have a supportive and loving husband, best friend, and running partner who shares my desire to make a community a better place. It's simple, he is a real-life superhero. I'm also thrilled that my son Maxfield could join us this morning. He inherited my desire to make a difference. He's helped with Truckee River Cleanup Day, he's worked at the Great Basin Community Food Co-op, and he's sorted donations at the Food Bank of Northern Nevada. But he's most passionate about saving sharks and the oceans that they live in, so he's truly fearless, and I adore being his mom. Again, many, many thanks to the Human Services Network and all of you. You offered an encouraging shoulder to lean on, an ear to listen, a glass of wine, or a cup of tea over this last year. I truly appreciate all of you, your expertise, your support, and your dedication to making Northern Nevada a healthy